Keeping your hands clean is one of the most important steps you can take to avoid getting sick and spreading germs to others. So be wise and wash your hands regularly to keep those germs at bay. Get more tips for healthy living by tuning into Kaieteur Radio every Monday at 1:05 p.m. for Your Health Matters.
Good afternoon, everyone, and welcome to another edition of Your Health Matters here on Kaieteur Radio. I'm your host, Rihanna Ramsey, and today we will be discussing polycystic ovarian syndrome, or PCOS, which, according to globally publicized information, is the most common cause of infertility in women. Yet a large group of women are still unaware of the condition, its effect, and dangers to their health. In Guyana, PCOS is not often openly discussed as other reproductive health conditions, but it affects quite a number of women. Given the magnitude of the issue globally, September has been designated PCOS Awareness Month. Joining us virtually today are three women who will give us some insight on PCOS. They are Dr. Umadai Ratan, of the head of the Women's Health Unit at the Ministry of Health, Dr. Tumika Luncheon, who is also attached to that unit, and Ms. Kimberly Manbo of the Sisterhood Support Group, a local NGO that deals with women affected by PCOS. Welcome to the program, ladies. Good afternoon.
Good afternoon.
Good afternoon.
Hi, good afternoon.
Okay, I can only see, I think it's Kimberly. I think we have a little issue with our net, so we won't be getting to see you ladies on camera, but we will be hearing you, and I think that's enough. Kimberly, welcome to the program. This is your first time here, and just to give our viewers and listeners a little bit of insight on yourself, just tell us a little bit about yourself, a bit about your academic background, not too much.
All right. Hello, everyone. My name is Kimberly Manbo. I am currently a medical student, and also I am the CEO and founder of Sisterhood Support Guyana.
Mm-hmm. Okay, Dr. Ratan and Dr. Luncheon, they are, you have to say, regular guests here on Kaieteur Radio's Your Health Matters show. And so we'll start with them. They're medical doctors, and they deal with a lot of women's health issues. So we'll start with them. And our first question will determine or give person some clarity on what PCOS is. Dr. Ratan, you want to take that question?
Okay, sure, no problem. So, what is PCOS? PCOS that's an abbreviated term.
Mm-hmm.
It's polycystic ovarian syndrome. Some people call it polycystic ovarian disease, disorder, syndrome, all the same names different names that people call it. That's what it is.
Yeah.
So it's basically how we could say in layman's term. It's actually like a hormone imbalance that women would have, and it has different characteristics. We will go on to discuss that a little bit further. And of course, it affects women, ovarian as the name says. It affects women. And that's basically what it is. But we'll go on to talk about the characteristics and so as the show goes on.
Well, it affects women, but how early is it diagnosed? Is there an age range from what age can you pick it up in somebody?
Okay, so that's something that it's not specific, because it's not something like, you get a cold and you get the flu, or something happens and you go to the doctor right right away. It's actually, sometimes it's an incidental diagnosis, meaning that you just go and you probably do an ultrasound and you find out, or like somebody stops like missing their periods and they decide to go and for following or the test they find out, and that's how it's diagnosed. So it's not necessarily diagnosed at a specific age, or diagnosed because or at only diagnosed at 13 or when the period starts or anything like that. It's as long as you reach puberty and you start having a problem, or you start missing your periods, or there's a worry or a concern about this, sometimes that's how the patient ends up in the clinic, and that diagnosis is entertained and further confirmed. Also, it could be you go your whole life and you actually don't know, and at the time when you're actually trying to conceive, that comes up.
Okay. And I'm sure there's symptoms. You can talk about the symptoms generally, but I'll have Kimberly chime in, because I know that she was diagnosed. She's actually a person who has the PCOS, and she can talk about what they go through personally. So for those general symptoms, what can people expect? Women, girls.
Okay, well, I can let Kimberly start, and then I'll just continue. She might just touch on. So you could go ahead, Kimberly.
Kimberly?
All right, so the symptoms may vary from person to person, and since it's a hormonal disorder, that means you may have an imbalance in your hormones. There's also an elevation in your androgen hormones, and these are our male hormones, which are found in females as well. But when these hormones, specifically testosterone, becomes elevated, then that is something you can look for. You can also look for the morphological presence with the ovaries, ovarian dysfunction, whereby your ovaries aren't functioning as normal as it should, meaning you're not releasing eggs as you should, you're not releasing the hormone estrogen as it should in women. So with those symptoms, now you can have signs of the disorder. So persons may have, females may have, they may also have excessive hair growth in regions where it's more dominant in males. So you might recognize that they're having hair, beard, hair growth, and the back. They may also have darkness, hyperpigmentation of the skin in areas where there's folds, such as the neck, the groin. So, and also hair loss as well, or baldness. So those are some of the common symptoms and signs that one may experience. Also, that may want to alert them that, okay, maybe something is going on with me, so I need to check with my physician.
Okay. In terms of, is there any pain? Because I spoke to a few persons, and they said that, not just the irregular periods, but you can have pain as well, severe pain.
Okay, so menstrual, there's menstrual disorders also accompanied by this PCOS, because persons may either have absent menstruation, whereby they may not have a period for over 30 days, or a person may also have prolonged bleeding, whereby they're bleeding for more than 12 days. And of course, you may have some levels of severity where there's very uncomfortable periods where you may be having heavy bleeds, clots, and so on. So it do vary from person to person.
Okay. In terms of general, this would go to Dr. Rattan. The general symptoms, what are, Kimberly touched on some. What are some of the others that you would see appear in some of your patients and the women who are affected by PCOS?
Okay. Most of them, Kimberly already covered, but just to run them back a little bit. Sometimes, as I said, sometimes you have absolutely no symptoms at all, and even though, let's just say, most of the women with PCOS, they don't produce eggs, or that's how come the infertility part we're going to discuss a little bit later. Some of them don't get their periods, and some of them do. So having a period alone, that's not that. Sometimes you could still have your periods and still actually have PCOS. So that alone is not something. It's like a combination. What Kimberly said about weight gain, that's something we look at. We look at the darkness around your neck. We also look at ultrasound diagnosis. And the thing is, it's important that when you have an ultrasound done, it's done by qualified or certified sonographers who, a lot of times they say polycystic ovaries. And now I'm going to go into a little bit of the confirmation and diagnosis. You don't just see some cysts or something and then just say you have polycystic ovaries. These things, it needs criteria, and later on we'll touch on the Rotterdam criteria. That's for diagnosis, and it includes you have to have a certain amount of follicles or little cysts, you would say, on your ovaries of different size and appearing in the ovaries before you could actually diagnose it. So sometimes some women are actually condemned to the diagnosis of PCOS when in fact it's really not true. So we have to be careful when we're putting this picture together, all the symptoms together, and giving a woman this diagnosis. The other thing is we should always put together our clinical, what the person is manifesting, what they're showing, what we're finding, as well as I mentioned, ultrasound, and as Kimberly mentioned, the androgens. Because if that's we talk about testosterone, that if that's elevated, well, we put all together. It's not advisable to just use one thing and look at a woman maybe who has gained weight or who hasn't had her period for a while and, oh, well, you have PCOS.
Okay.
So it's like putting together a whole picture, a whole puzzle together before you diagnose.
Dr. Lanchan, I'd like to hear from you as well. I know you're there and you're probably eager to join in. In terms of the cause, has there been an identified root cause for PCOS?
So there's actually not an exact cause, it's not clearly defined. We do know that, as Dr. Atan and Kimberly would have said, we do know that most of the women who do have PCOS have some amount of what we call insulin resistance, whereby their body produces the insulin, but they don't use it well. And that can actually cause higher androgen, or as Kimberly would have said, the male hormones. But in terms of it being a specific cause, that has not been identified. We do also know that there is some amount of genetic components in it, where if you have a mother or sister with PCOS, you are more likely to have PCOS than somebody who doesn't have a first degree relative with it. But in terms of specific causes, no. We know obesity and so also tend to see women who are more obese with PCOS, but it does not mean that every single obese woman has PCOS. So there's not a clearly defined cause that I can say that once you have this, you will get PCOS.
Kimberly, who's from your perspective, who's at risk of getting PCOS? Who's at risk of the disease, of the condition? Sorry.
So, of course, women and women of reproductive age. So, if you're between the ages of 12 to 51, you're at risk of getting PCOS. But most times, by time that age, you may stand a chance of, recognizing that something is wrong, and then you might be diagnosed with it by then.
Is there a particular, for any one of you, this question goes, a particular group of women or particular ethnic makeup or anything that could make you more susceptible to having that disorder? Hello?
Well, studies have shown that Hispanic women are at risk for the disorder, but also as it relates to genetic, this can predispose you to the disorder as well.
Since it affects the fertility rate, and can a person who has the or was diagnosed with the disorder, I keep saying disease, can they still get pregnant? Because how often does it happen that persons with PCOS get pregnant?
So,
Yeah,
you wanted to
Doctor, any one of the doctors could take this one.
Okay, well, Kimberly had something to say, but I'll start. So, as Dr. Rattan would have mentioned, it is possible to get pregnant with PCOS, and that is even bearing in mind that this person may not have had treatment, because as you would have remembered, not every single woman who has been diagnosed with it will have the irregular period. There's a criteria to diagnose the disease where you have 2 or more components of that criteria that tells you if that person falls under the classification of PCOS. So they are women that do have PCOS, they do ovulate, and they can get pregnant. There are women who have gotten pregnant. And while it can be a little more difficult, there are women who have gotten pregnant and who do suffer from PCOS. I think Kimberly had something she wanted to add.
Go ahead, Kimberly.
Well, you would have touched most of it, because we have women who are living with PCOS and had successful pregnancies, have 3 kids, 4 kids. Some may have experienced miscarriages or, a little bit of challenge during their pregnancies. But I think what usually happens is that persons usually, I want to say, misdiagnose or mix up having PCOS and PCO, whereby you have ovarian cysts versus having ovarian syndrome.
Okay, and in terms...
So I would like to weigh in there, just adding to what Kimberly said, that's what we were talking about a bit earlier, about ensuring that the diagnosis is correct, ensuring that the ultrasound is done properly, and there's the Rotterdam criteria that we use, and the amount of cysts and the amount of the size of the cyst also. So that's just to add to that.
So if somebody has PCOS and they get pregnant, does that mean that they are cured from the disorder?
No,
There's
no cure.
there's no cure.
So
If I may, so there is no cure getting pregnant. This is just one of the potential causes of being infertile or have what we consider as subfertility. Getting pregnant doesn't mean that you're cured, as we would have mentioned, that you can have it and still get pregnant. Even for women who have a more difficult time getting pregnant, there are treatments that we do use in the medical practice to help them to ovulate better so that they can become pregnant, but it doesn't mean that they're cured. As we would have mentioned, this is a hormonal disorder and imbalance. One of the most important mainstay of the treatment for women with PCOS, and what we definitely promote, is always been weight loss. And we find that with weight loss, it helps the women to ovulate more frequently. But in terms of curing you from that disease, it's not a curable disease in that context.
Okay. So we'll take a short break, and when we come back, we'll talk more about PCOS, and we'll go into a bit of the treatment that is available to those affected by the condition.
Getting vaccinated is important in protecting yourself and those around you. The COVID-19 vaccine is not a cure. The Ministry of Health's vaccination drive is to remove the virus's ability to cause hospitalization. It helps to look at your exposure to COVID-19 like this. Best case scenario, you don't get infected, and the worst case scenario is death. Get vaccinated today. This is a message from Guyana's Ministry of Health in collaboration with PAHO WHO.
Welcome back to the program. You're listening to Your Health Matters, rather. I'm your host, Rihanna Ramsey, and we're discussing PCOS or polycystic ovarian syndrome. We have with us three women who are, two of them are doctors, and the head of an NGO, Dr. Umaday Ratan, head of the Ministry of Health's Women's Health Unit, and Dr. Tamika Luncheon, who's also attached there, and Ms. Kimberly Manbo of Sisterhood Support Group, a local NGO that deals with women affected by PCOS. Ladies, are you back with me? Hello?
Yes, we're here.
Yes,
We're here.
They're joining us virtually, and sometimes we have a little bit of issues getting them on camera. Sometimes you will see them, and sometimes you won't. But as long as you're hearing them, that's important. So we're discussing PCOS. We talked about the risk and who is at risk of getting the condition. And now we're going to go into the treatment, what is available to those persons who are affected by PCOS, and how can they take care of themselves? Dr. Ratan, can you touch on that, or Dr. Luncheon?
So I can start us off with the modifiable things that we can do. And as I would have mentioned before we went on break, one of the first steps that we would advise women, especially women who are overweight and suffer from PCOS, is for you to lose weight. Being overweight or obese actually helps, as I would have mentioned, it helps to normalize. Once you've lost weight, that helps to normalize or reduce the insulin resistance in your body, and you tend to ovulate more frequently. So that's one of the first things that we would advise women. For women that we also know that have insulin resistance, we do have, depending on whether the person desires to achieve a pregnancy or to conceive, or if they may not be interested in conceiving at the said time, we would put them on hormonal birth controls, or if they do want to conceive, then we may put them on a medication that helps them to ovulate. One of the other things that we also do, we also use one of the medication that's used in the treatment of diabetes that helps to improve some of the symptoms of PCOS. I'm not exactly calling names of the drugs because I don't want people to just go to a pharmacy and purchase medications. Because as we would have mentioned, this diagnosis is actually made based on a criteria. We find a lot of persons are running around saying that they have PCOS without actually fitting the diagnostic criteria for the disease. And it's being misdiagnosed basically. So that's why forgive me for not calling specific names or going very specific into treatment, but we're trying to promote that everybody has a holistic approach and they're treated from a healthcare provider who makes the proper diagnosis using the Rotterdam criteria.
Okay, so it's better if they go to their doctor, their physician, and they get examined, and then they get the correct diagnosis and the correct, prescription or recommendation on how to treat it. That's what you're saying, basically.
Exactly. So the diagnosis shouldn't be that you go to somebody and you notice that you're gaining weight and you have a little bit of excess of facial hair. In medicine, there are many diseases that can actually present that way. So ideally, to have a proper diagnosis, you should be seen by a physician, have the necessary tests, as Dr. Athan would have said in this case. We do, and Kimberly would have mentioned, we do hormone panels for these persons, as well as an ultrasound to see the presence of cysts. We look at the diameters of the cysts, how big they are, and so. And then we also use that in combination with how their periods come. So we don't just base it on one thing, or you're a little overweight, you have PCOS. So the best way and treatment is after a correct diagnosis, an evidence-based diagnosis, then we would put you on the treatment depending on if you want to get pregnant, or if you just want, or if we're just trying to improve the symptomatology, improve your symptoms, your excess facial hair and those kinds of things.
In terms of worst case scenario, when somebody has PCOS, what is the worst that they can expect to happen to them? They won't die though. Or can they develop long-term conditions that lead to, well, you know. Hello?
Yeah, I I guess I can answer that. So while PCOS is not a life-threatening disorder, it can lead to long-term conditions such as type 2 diabetes. One can experience cardiovascular illnesses. So if not diagnosed earlier, properly managed, then one can be at risk for these diseases.
Okay. Dr. Ratan or Dr. Luncheon, you want to chime in?
So I would
as
just
Kimberly,
oh, go on, Tamika.
I was just going to say that I also agree with what Kimberly has said, and I thought she was one of the best persons to answer it because I'm pretty sure she has done her research and from her personal affiliation with this. We do agree. I do agree. It is not life-threatening, but you are at risk or you are prone to develop more lifelong conditions. We do watch women who tend to have polycystic ovarian syndrome. We tend to watch them for them developing type 2 diabetes and cardiovascular complications. But we should be watching for that in every single patient, not just them.
You mentioned misdiagnosis earlier. How often, I don't know if you can tell me how often this happens in trying to or looking for PCOS.
So what we have found as this was actually mentioned a little earlier. We have, when Dr. Ratan touched on the fact that ultrasounds are being done by any and everyone right now in Guyana, not necessarily qualified providers. We have found that a lot of women will come to the doctor with an ultrasound saying that they have their ovaries look like if they have polycystic ovarian syndrome. However, that is, as we would have mentioned, that's not the criteria alone to diagnose. You need to know, first of all, you need to know the different size of the follicles, how much fluid they contain or not. And then what happens, ideally, what we promote for the diagnosis of PCOS is actually a transvaginal ultrasound. You can see polycystic ovaries on a transabdominal, meaning that they use it through the abdomen. They look at the ultrasound through the abdomen. However, the best way to do it is through a transvaginal. So they'll actually do the imaging through the vaginal canal, right? And then that's not the only thing that we would use. The woman would also have to have history of an abnormal periods or not having periods at all. She would also have the other symptoms that the girls would have already discussed. So what happens that we find are persons are going to get an ultrasound and incidentally finding their ovaries may look like they have cysts on them, and they're coming because they're under the impression that they also have this diagnosis, and it's not necessarily true. We have women that have absolutely no problem. If you do their hormone panel, everything is perfectly fine, but they had some ultrasound that they did around the corner that says that they saw cysts on the ovaries. So ensuring that the diagnosis is made based on all the different criterias, and as well that your ultrasounds, when you do it, that they're done by a qualified or a recognized provider is very important. I think Kimberly has something to add.
Yeah, and just to add to what Dr. Luncheon is saying, to really differentiate it, that the cyst that you find in PCOS is basically follicles whereby their immature eggs are housed. So these eggs they do not mature enough or they are not released. So that's what I would have mentioned earlier as it relates to PCO and PCOS, whereby you may have ovarian cysts, and then there's the ovarian syndrome.
So in terms of women who are having trouble as a result of having the ovarian syndrome, what do you recommend? I know IVF is one way women use to get pregnant despite having issues, but what are some of the other ways that you can use to like treat persons who are trying to get pregnant with PCOS?
So the medications, I'm not going to call the name. We do have fertility drugs that we use once we've confirmed that the patient does indeed have a problem ovulating. I'm not calling names because we've also noticed a rise in patients attending pharmacies and just purchasing these drugs over the counter. There are medications that do help those, as Kimberly was explaining, those immature eggs to mature so that they can become the size where they can be fertilized and you can achieve a pregnancy. So in vitro is not necessarily the first step. We actually will try using a fertility drug first before we go ahead and say that, this can't work. And there are women who have gotten pregnant using the fertility drugs.
So
right?
So what you're basically saying that these drugs are quite accessible to treat, because you're saying over the counter.
It shouldn't be over the counter, but quite a few things in Guyana are over the counter, as we would have noticed.
And how dangerous?
That doesn't necessarily mean it's okay or it's legal, but there are quite a few drugs that shouldn't be accessed over the counters, and we do get access to them.
So how risky is taking a fertility drug from over the counter to one's health? Basically, I don't know. You have to touch on that because people are, as you say, they're using the stuff just trying to address their issues and they don't know the danger.
It's more than fertility drugs, Miss Ramsey.
Okay.
And I find every time I do a program, I think the pharmacists might think that I'm attacking them. But while the patients might go, it's a Guyanese culture, While the patients might think they could go and get it, it's our responsibility as healthcare workers to say no and to say, because sometimes we're causing more harm. And yes, we're talking about like PCOS now, and we're talking about the infertility drug. And one of the most common ones, people actually go and we get patients that come and they would have bought this at the pharmacy and that at the pharmacy. And they even go to the pharmacy to show the pharmacist the ultrasound about polycystic ovaries and the pharmacist treating it. I mean, there are different things. And way back in the conversation when Dr. Luncheon and Kimberly touched on treatment, the treatment, as they rightfully said, it depends on what the manifestation is and what is happening. If they want to get pregnant, if they're bleeding, prolonged bleeding, if they're getting all the period symptoms but no period, and then you can't there isn't a generic treatment. And a lot of these things are sold over the counter, just to sidetrack a little, and that's not advisable for any treatment. And we're seeing that for not only for infertility but also the opposite end of infertility, which is for abortions. And that's really a lot of work we have to do with the pharmacists for that.
Okay. We'll touch a bit on awareness because September is PCOS Awareness Month, and I know Kimberly has been working with her nonprofit spreading awareness. That's her area. But I also have you ladies touch on how the Ministry of Health is doing what you're doing from the Women's Health Unit's perspective on to spread awareness for PCOS. So let's go to a little break, and when we come back, we'll have more on PCOS awareness.
Kaieteur Radio, keeping you informed.
Demerara and Essequibo 99.1 FM.
Burby's 99.5 FM. Kaieteur Radio.
Welcome back to the program. You're listening to Your Health Matters here on Kaieteur Radio, and I'm your host, Rihanna Ramsey. We have with us Dr. Umanai Ratan from the Women's Health Unit, Dr. Tamika Luncheon from the Women's Health Unit at the Ministry of Health also, and Miss Kimberly Manbo of the Sisterhood in Support Group, a local NGO that deals with PCOS. And this is PCOS Awareness Month. We're dealing with PCOS awareness, and these ladies will tell us, we'll start with Dr. Luncheon or Dr. Ratan. They'll tell us what they have in store for us during this month, because it's PCOS Awareness Month, and they're doing their own bit of work as it relates to spreading or sensitizing the public. Dr. Luncheon and Dr. Ratan?
Okay, so we are doing a lot of health promotion and health education at the community level, via social media, as well as health talks at the health centers, as well as at district hospitals, health posts, health centers, and district hospitals. We're doing a lot of awareness and health talks and to that effect. Also, what we did and what we're continuing to do in observance of a polycystic ovarian month is doing trainings for healthcare workers of all levels, nurses, doctors, community health workers. We've been doing that for we've completed in a couple of regions so far, training specifically for infertility and polycystic ovarian syndrome, ensuring that the health workers understand their mandate as it relates to women's health and infertility and polycystic ovaries. Because as we've been saying, I think one of the points that we kept going over was that it's overdiagnosed. And when you have a patient with this, how do you go about doing it? So a lot of the work that we're doing is with training and capacity building for the healthcare workers, and some health promotion activities on social media as well as in person.
Kimberly, what's your group doing? I see you have like a whole month of activities. Tell us about what you're doing in terms of spreading awareness.
All right, so we have special features throughout the entire month where we have Advocacy Sundays, whereby persons who are diagnosed and living with PCOS will share their stories and journey as it relates to PCOS, and also help to advocate for those who are diagnosed with PCOS. There's also Teal Tuesdays, whereby we're encouraging persons to wear something teal to show their support and to raise the awareness of PCOS. And by doing this, if someone sees you wearing something teal, a conversation starts, and then you're able to inform them, okay, this is what PCOS is, or this month is PCOS Awareness Month. There's also our question and answer Thursdays, whereby frequently asked questions will be posted on our social media pages with answers from various specialists as it relates to PCOS and coping mechanisms. So those are the 3 special feature days. And yes, we do have a month-long calendar of activities. Today at 6:30, we'll have our first virtual session on PCOS, and it's called My Ovaries Got Pearls. And this session will be facilitated by our very own Dr. Sam Lal. She is a women's health specialist and gynecologist. So we will have a presentation on PCOS, and it will be in the most simplified manner, because though there's so many information out there as it relates to PCOS, we still have to cater for those who may not yet fully understand the disorder. And then I have an awareness session, a wellness session as it relates to PCOS and wellness. Then I have another session on eating with PCOS, and also one called Bridging the Gap. Bridging the Gap is a very important session, because for this year for PCOS, last year we tried to raise the awareness. Now we're trying to link everything surrounding PCOS, and Bridging the Gap is so important to us because this is where we include our males. We're trying to make them to become informed about PCOS so that they can better help their partners cope with PCOS. So those are some important awareness sessions that we will be having throughout the month, and of course virtually as it relates to that.
Okay. You said that a lot of your activities are being promoted via your social media, which is your Facebook page. How can persons find that page? And could you spell Sisterhood Initiative out, because sisterhood out for them, because they will spell it SISTER, but it's not spelled that way.
Yeah. So it is CYSTRHOOD, Support Guyana. On Facebook, you can find it on Instagram. And for those who may want to ask questions or make contact with us, they can get us via WhatsApp on 674-1210. So their questions can be sent there as well. And on our social media pages, there we have daily updates. We have all the activities that I would have mentioned and more.
Mm-hmm. Your NGO was launched last year, September 4th actually, and it's been 1 year since it has been launched, and I mean, you focus a lot on support. How important is support in the whole aspect of dealing with PCOS?
So, well, we were launched on the 1st of September last year on PCOS awareness.
The first, yes. Yeah.
And so our main goal was to, one, allow persons to know that there is such an organization or support group established in Guyana, and also to raise awareness on PCOS, because if I can compare last year to now and the years before, there's a lot of more conversations, a lot of more sessions being done as it relates to PCOS, which I think it's great. It was a great move by the organization to bring the much needed awareness in Ghana as it relates to PCOS. So now that persons are more aware, you have more persons looking into, their physician visits, following up and so on. As it relates to support, and this is something I need to make clear, that Sisterhood Support Ghana is not a clinic. We're not an institute or a facility, whereby persons can walk in. Mm-hmm. It's a support group, like the name says. And the only reason we're unable to physically meet is because, of course, one, we're currently in a pandemic. So to minimize adding any more stress or crisis to the health system, we try to meet virtually. And the support comes in many forms. So apart from educating persons and raising awareness, I think a challenge that many women face, and even physicians, is that persons don't usually adhere to treatment. So, you're placed on treatment and then you may see little to no progress. So you decide that, okay, this isn't working for me, and you come off. So something that we want to do is to help persons adhere, follow up with them and their treatment, check in to see how they're progressing, because a physician may not be able to manage all their patients in that way, though that may be a better approach to see a better outcome. That is something we want to do. So we would enroll persons. We're now going to have membership given out. So we'll have a client number and more or less create a database for persons. So once you're diagnosed and we can follow up with you, we can give support in many ways.
Mm-hmm. In terms of the general, what's generally available for persons affected by the condition, Dr. Ratan or Dr. Luncheon, where can they go? Can they go to the normal clinics, or is there a established unit that they can go to so that they can get their concerns addressed?
Okay, so this we usually in primary healthcare, we start treatment at the health center, the health post, the health center level, and then we move up. So they start the conversation with the physician who is at the health center or the health facility. So it's actually at all across the country, at all the facilities, the doctor or the general medical practitioner is capable of diagnosing and treating. Depends on what the need is. That I should say that, because as we said, the treatment depends on what the symptoms are. It depends on how old the woman is. It depends on what her reproductive needs are, and those, as long as those criteria, they're sorted out, then we would address at which level of healthcare the woman can be treated. Because, for example, if everything's fine, but now she's trying to get pregnant, and the infertility part, well, that can't always be addressed at the primary healthcare level. That might need a little bit more specialized care. So then you need hospital level.
Okay, that would be done privately. That's what you think?
No, okay. No. It would need we have district hospitals, regional hospitals, as well as the Georgetown Public Hospital. But the Georgetown Hospital should never be your first option. That should be reserved for the patients who cannot be handled at the other levels. But we're talking all public system.
Okay. in terms of persons getting information, we're about to wrap up now. General information, how can they? I know Kimberly gave us a bit of rundown of sisterhood support. In terms of the public health sector, can they go into Georgetown Hospital? Can they contact the Ministry of Health Women's Health Unit? Where can they go on Facebook? Where can they go to?
We have a women's health page, women's health on Facebook page. We have the Ministry of Health page. Right now, we don't have a lot of information on as it relates to polycystic ovaries on that page, but over the course during the month, we're going to keep posting stuff so you could visit that page, the Facebook page, Women's Health. We also, any health center you could go into and ask the healthcare workers for information that's available too. And we do have a telephone number, 223-5310. You could call for more information and we could probably guide you if you need any further assistance or through a pathway, what do you do, what's next, and so on. So that's 223-5310.
For those who didn't hear you earlier, Kimberly, you want to reiterate some of the information about sisterhood support and how people can get in contact with you?
Right. So, Sisterhood Support Guyana is a support group that caters to women living with, diagnosed and living with PCOS in Guyana. As part of our mandate is to want to educate and help persons to better cope with this disorder. And for persons who wish to access information or to make contact with us, they can do so via our Facebook page, which is Sisterhood, CYSTRHOOD, Support Guyana, Instagram or WhatsApp on 674-1210.
Okay, thank you so much, ladies, for sharing with us here on Kaieteur Radio. Thanks for those who joined. You're free to post your questions even after the show is finished. I can forward those questions and get the responses for you to the doctors or to Miss Mambo. And you've heard from them, you've heard where you can go and get information if you want to know more about PCOS. So that brings us to the end of our program today. Thanks again for watching, for listening, and I just hope that you take good care of yourself. Wear your mask, practice social distancing, wash your hands properly, and stay well until we see you and hear from you again.
Thank you for having us.
Okay.
Sure.
Thank you for having us.
Sure.
For having us.
Bye.